Thank you, Greta. I'm very pleased to be here, and I appreciate the invitation. And my fellow panel members, I think, will give you a good perspective on how tobacco control is central to cancer control and cancer prevention, and also how it's a little different in that as we endeavor to do what needs to be done, we have an opponent who endeavors to keep us from doing what we want to do, which is the tobacco industry. So it makes it even more challenging and important that we do what we know works as well as we can. What I'm going to do is provide a bit of an overview of if we're serious about tobacco or serious about cancer control, you really have to focus on tobacco. And I think someone mentioned earlier today that tobacco control is a best buy in terms of cancer prevention. And I think hopefully I'll reinforce that point. But there are 5 major points I want to make in my remarks. The first is that tobacco is the leading cause of cancer and almost all of the lung cancer in the world. And at the same time, we have strategies on how to prevent tobacco use that have been articulated to the point where it's actually international treaty, that these interventions don't cost much and can be done equally well in low resource and high resource settings. And it's not about money, it's about political will to actually implement the strategies that are effective, because they're often politically unpopular, or at least they're made out to be by the tobacco industry. And then last point, which will segue into the next presentation, is that as we go forward, governments must be alert to the interference of the tobacco companies in efforts to prevent cancer, which is even a hard thing to imagine that anyone would be opposed to preventing cancer, but actually, in essence, there is. So I will run through most of these slides fairly quickly. The basic point I want to convey is that tobacco is the leading preventable cause of death in the world. We currently estimate about 6 million people died early and unnecessarily because of their use of tobacco, and it is true across all WHO regions, with Afro having the lowest level of harm and Wipro having the highest level, and you'll be hearing from experts about Southeast Asia a little later. The burden in the U.S. is the updated estimates from CDC is 480,000 deaths a year just due to cigarette smoking, and somewhat sadly, you can see that lung cancer is the single leading cause of why people die from tobacco use, over 137,000 a year. And just to really depress you, and I tell my students that's my job, is to depress them and make them discouraged, is that if you add together the deaths from the next 4 leading causes of cancer death in the U.S., of breast cancer, colon cancer, prostate cancer, and pancreatic cancer, it equals the number of lung cancer deaths on an annual basis in the United States. I find that statistic phenomenally depressing. And there's really only one of those that's truly, completely preventable, and that's lung cancer. And that's the one, in many ways, we do the least about from a prevention standpoint. And I guess, and now, well, in this context, and I will not mention the word e-cigarettes other than right now, but the fact of the matter is that these deaths are primarily attributable to the smoke that's inhaled from combustion of a burning tobacco leaf. And you can see a picture of a healthy lung versus a smoker's lung. So not all the deaths are due to smoke, and I'll say a word about that, but fundamentally they are. But the last slide I'll show you on the health effects is, again, somewhat depressing data from Poland that is from Richard Pito. And what he did was he looked at the mortality rate over time, and he did this for the US and UK, but I like Poland's data, where this is the death rate from non-tobacco related cancers, which was declining from the 1960 until the present day. And you can see that in Poland, there was success in reducing tobacco mortality when you take out smoking-related cancers. When you look at the cancers that are caused by smoking during the same time period, you see this incredible spike to the point where smoking-related cancers deaths exceeded all other cancer deaths. This is in middle-aged men, 35 to 69. And still today, in Poland, you're more likely to die from a smoking-related cancer than all other cancers combined. And to have this happen on our watch, to have tobacco-caused cancers exceed all other cancers is really, I think, a collective embarrassment. Well, enough of the depressing news. Well, not quite, I guess I can't. So let's talk about, it's not just smoking, it's also smokeless tobacco. And we're talking about a global issue here, so we need to look at smokeless tobacco. We need to be cognizant of the fact that smokeless tobacco is used in 70 countries around the world, 300 million people. And this data just came out this week from the International Journal of Cancer, which was a meta-analysis on smokeless tobacco use in oral cancer. And those of you who are familiar with viewing meta-analysis, this is no risk. This is a relative risk of 1. And here are the studies that have been published on oral cancer caused by smokeless tobacco. And you see a pretty clear picture of what we're experiencing. Primarily in the South Asia, but not exclusively. So as we proceed and talk about tobacco and cancer, it's important to realize it's not just smoking, it's also smokeless tobacco. And also, it's not just oral cancer. If you look at data from the same study that looked at the population attributable fraction in India, was that smokeless tobacco also accounted for a large proportion of cancer of the mouth, pharynx, larynx, and esophagus and stomach. So it's not just lung cancer and smoking in the West, it's also hundreds of millions of people are using harmful smokeless tobacco throughout the world, particularly in South Asia. So no more on the harm. Let's now turn to the good news, which is that there are things that can be done and are being done and are making a difference. The first of that is there are evidence-based guidelines, and we're very fortunate in tobacco control to have a series of them, and I'll just say a word about them. Primarily, in this country, we rely a lot on Surgeon General's reports. Globally, the major reports have been the Empower report by WHO, which was funded by Bloomberg Philanthropies and I'll say a word about that, and also those interventions that are outlined in the Framework Convention on Tobacco Control. And it really comes down to something as simple to this, is that with all of these collective reports that are evidence-based, there are really 4 policy efforts that are recommended to control tobacco use. Tax increases, clean indoor air laws, advertising bans, and graphic warning labels. Now, these are all, each of these could have an hour presentation on the evidence and the status of the implementation, but suffice it to say that in countries where these things are done, we see very rapid declines in smoking. The problem is that they're all really hard to do because the tobacco industry fights them in very clever ways, and also they are policies that require governments to take action. And when's the Republican debate occurring? Is it tomorrow? Sometime this week? Just watch that and you'll know that all of these things would be considered anathemas, whether it's a tax increase or regulation or, graphic warning labels is, the U.S. has some of the weakest warning labels in the world, because stronger warning labels would be considered violations of the Constitution. Really? How did that happen? I thought the Constitution was about freedom of speech. So, all of which is to say, there are effective policy interventions that are being done around the world, and you'll hear stories about them shortly, that are codified in the framework or in the Empower strategy, and also in the Framework Convention, which has been ratified by 180 countries around the world. There are only 193 countries, if you're curious. So 13 have not, and the U.S. is being one of those. So the Framework Convention for Tobacco Control still resides in the White House and has never been submitted to the Senate for ratification, even though it was signed by Secretary Thompson in 2003. How many years ago was that? 12 years ago. So it's still being vetted politically. And in the meantime, we could calculate, let's see, 480,000 deaths times 12 years. The numbers add up pretty quickly. So there are evidence-based strategies. You'll hear more about them. We can discuss them. As I said, the FCTC is the framework. It's the largest, likely the largest treaty that's ever been done in the world. And we're not members, but the rest of the world is endeavoring to comply with it, and that is a challenge because the industry tries to interfere in its full implementation. So the third point I want to make is that these strategies don't cost a lot to do because they're policy interventions. They're not treatment, they're not screening, they're not individual-based activities, they are policies. And these policies can be done in a way that has little cost. Warning labels, for instance, is borne by the companies. Clean indoor air laws, actually, the evidence is that if you have a clean indoor air law, a building saves money on maintenance costs. The evidence on a tax increase is you make a lot of money. I mean, the U.S. receives billions of dollars in revenue from tax increases. So ironically, although we have a hard time implementing these things, they not only don't cost anything, they actually make money. And the money can be utilized for other purposes to fund some of the other activities we've been talking about today, but that's not being done. And then the question is, why is that not being done? And it's not being done because either they're politically unacceptable or they're being interfered with by the industry. This is a busy graph, but let me just, again, put your depression hat on. This is the revenue that countries receive on average globally from tobacco tax revenue. So globally, if you look at all the smokers in the world in all 193 countries, they receive $10.74 per person. If you look at what WHO says it's going to take to implement effective tobacco control strategies, it would be 11 cents a person. And what's actually being spent is about a penny a person. And so you have a situation where you're talking about orders of magnitudes of disalignment. In the United States, we spend a couple of dollars per person on tobacco control. Globally, it's a penny a person. And most of that, you know, unfortunately, is from Bill Gates and Mike Bloomberg. It's not coming from development agencies or from countries themselves. It's being supported by two of the richest men in the world and they won't do it forever. They will only do it to establish proof of concept. These things work. I'll just briefly, this is a picture from Israel showing what happens when the price of cigarettes goes up and the consumption goes down. You could pick whatever country you'd like and show the same graph. That there's an elasticity associated with tobacco. It's basically for every 10% decline or 10% increase in price, there's a 4 to 7% decrease in consumption. It's just basic economics. The other area that actually may cost something are media campaigns. And, you know, for the first time for the first time in my lifetime, there are now national paid anti-smoking media campaigns. The first Surgeon General's report came out in 1964, and basically 50 years later, there are now paid media campaigns being conducted by what was called the Legacy Foundation, which is now the Truth Initiative, as well as FDA and CDC. So for the first time in 50 years, there's paid campaigns. And paid campaigns, as you would expect, cost money, but the other interventions that we talked about really don't. Warning labels, and I'll just simply say that in the rest of the world, countries are competing about how much of a pack of cigarettes is covered by a warning. And right now, Thailand has the highest percent, 85%. I don't even know if it's been calculated in the US, but most countries in the world have graphic warning labels. They have pictures. This is a picture this is the poster child of a warning label. This is Australia, where Australia not only put a warning label on the pack, but they implement what's called plain or standardized packaging, which means that there has to be a drab color, there has to be mostly warning, and that all you can put on is the brand of cigarette and the variety. And so this has been tested in Australia, was found to be legal, and is now being challenged at the World Trade Organization as being anti-trade and primarily on intellectual property grounds. But it is legal in Australia, and it's being considered by a number of countries in Europe as well. The complaint tends to be that you're usurping the brand by taking off the chevron from Marlboro, et cetera. But that's something to keep your eye on. Let me wrap up by just highlighting that it's not money, it's more political will that's needed to launch what we know works. We're in a fortunate situation. I know you can't read this, but this is from the Tobacco Atlas, a publication that I'm involved with, that highlights the efforts by the tobacco companies to stop countries from implementing these things. So they're actively engaged in litigation to prevent the known strategies from taking effect. And this is such a serious issue that the Gates Foundation, and I think it's with Bloomberg, have come up with a fund that countries can apply to defend themselves against the tobacco companies. So just imagine this. Countries are implementing their sovereign rights as a country to protect the public health. They're being sued by tobacco companies to prevent them from doing that. And because these countries don't necessarily have the deep pockets, a fund was established by, again, two of the richest men in the world, that these countries can use money to defend themselves against the tobacco companies. It's crazy, but thankfully for that investment. This is just an example of not only does the tobacco companies sue countries, but people sue the tobacco companies. And the tobacco companies have to declare in their 10K filings the extent of litigation and their concerns about it. But let me go to the wrap up to keep on time, to go to the last point, which is that in all of this, it's harmful. We know what to do. It doesn't cost much. The industry interferes, and that countries need to be aware and alert to this industry interference, and what we refer to as undue influence. I'd simply say, I mean, we could give dozens of examples, and you'll hear from the other two speakers about how the tobacco companies use their money to buy friends. One of the quotes was, "Let's be clear about one thing. Our fundamental interest in the arts is self-interest." So they fund homeless shelters, they fund arts, they fund a variety of things because they want friends to testify on their behalf, or basically to help improve their image. And that's really a big impediment. This is my last slide, and this is very busy, but it's something that we could talk more about later. But in the Tobacco Atlas, we propose that there, as a country, begins to look at regulation. There's a life cycle of regulations that starts about how tobacco is grown, to how it's manufactured and packaged and marketed and priced, and where it could be bought and used, and even how the product is disposed of. And ideally, countries should follow this comprehensive regulatory framework to treat the product commensurate with the harm that it causes. Thank you.